Do you have shoulder pain? Has your quality of life declined because of your pain? Are you not able to enjoy your normal activities and live the life you love and deserve? If shoulder pain has you up in arms, call Dr. Tuvi Mendel. Dr. Mendel is the expert in shoulder care, featuring non-surgical and surgical options to get you back to feeling your best and living your best life.
You know, shoulder pain can be a real pain in the shoulder.
Astute observation there, Sean. Thankfully, there's an area doctor who can help eliminate and alleviate all of your shoulder pain, Dr. Tuvi Mendel. Utilizing state-of-the-art techniques and treatments, Dr. Mendel offers elite care.
But don't just take our word for it. Let's hear from some of his patients.
Years ago, I had this surgery, reverse shoulder. I'm very happy with it. Works everywhere I want to move it.
Surgery's been 3 months since March 29th. This is the effects I can do with my arm.
3 months for my shoulder replacement, and I can do about everything possible with this arm and no pain, and that's the best thing I've ever had.
Doctor told me I'd never be able to reach the top shelf of my cabinet, and here I am. Clear up there and doing good. I can do everything except put my hand behind my back. And I'm working on that.
So how can you join the hundreds of patients Dr. Mendel has helped achieve a higher quality of life?
Let's find out.
So shoulder problems are fairly common, and we see them in all stages of life, young and old. Younger patients tend to mostly have sporting type related injuries that involve tendon, muscle, ligaments. Older patients can have similar problems with rotator cuff injuries, muscle, tendon, ligaments, or they can have more issues with arthritis and joint wear and tear. So basically, the way to look into the shoulder is to first of all make sure that indeed it's coming from your shoulder. A lot of time we see patients that have crossover symptoms from the neck to the shoulder, and shoulders and neck tend to have a lot of crossover type symptoms. Shoulder pain tend to concentrate around your shoulder, sometimes radiating down to your elbow, whereas neck pain tend to be more pain in the back of your neck and up behind your shoulder blade. A lot of it could be musculoskeletal, and depending upon what's causing the pain determines how we go about taking care of it.
It's been about a year ago that I was in Florida and I was chasing my nephew and I fell, tore my rotator cuff pretty bad. And I went to different doctors for almost 6 months before I had surgery. And now I feel great. My shoulder's doing real good. Done therapy for, I think it's 6 weeks. They released me, said I was doing so good. Oh, I think he'd done a terrific job. I don't hurt. Never had a whole lot of pain. I had some, but there wasn't any real bad discomfort. I'm happy with my results. I can move my arm quite a bit, and I'm happy with Dr. Mendel as a person. He explained everything to me, and I would recommend him. I don't have the pain that I did before I had this surgery, and I can move my arm all around, whereas before I couldn't move it very much at all. And so I'm happy with everything. Everybody's amazed at how good I done.
I do feel that the better conditioning your body is in prior to any type of surgical management, the better you're going to do after. The body, frequently I say, is like an engine. If your engine's out of tune, it's not going to do as well. If you tune your engine, you will do better. So taking care of yourself as it relates to function, conditioning, nutrition. So if your nutrition is off, your body's not going to heal well, and that includes making sure that if you have anything else going on like diabetes, that is under control, making sure that if you smoke, that you stop smoking, and making sure that you ultimately conditioned to undergo the surgical management. I think that if you look at surgery with horse blinders, you miss the whole picture as to how well a patient can do. If you address the entire patient and make sure that they're healthy, they eat well, they maintain their weight, they maintain their diabetes, they maintain all of the options that they need to with regards to blood pressure, and are staying in some sort of an exercise program, they will do much, much better after surgery.
So take care of your health, keep your engine tuned, and
Avoid talking out loud while writing things down.
you thought you were going to catch me there, didn't you?
It's not difficult. And neither is the path to patients getting back to 100%. Dr. Mendel offers a number of options, including surgical and non-surgical, and is happy to help you find the right path for you.
Traditionally, we want to make sure that the shoulder is indeed the cause of your pain, because frequently the neck and the shoulder tend to overlap, and shoulder pain tends to be more in the shoulder area and tends to radiate down to the arm, specifically in the front, whereas neck pain tends to be more in the back of your neck down to the shoulder blade, and sometimes further down into your hand with numbness and tingling. And sometimes there's overlap. You can have both neck and shoulder issues that needs to be addressed. So first we need to find out if indeed it's coming from your shoulder. And traditionally the symptoms that patients present with are shoulder pain, difficulties with motions. Some of them are from ground to waist level. Most of them tend to be from waist to overhead type of activities, whether it's recreational sporting, lifting, work-related activities. A lot of time you have pain at night, and those type of issues needs to be looked at if the symptoms don't get better within 6 weeks or so, 3 months. If you're noticing that it wakes you up at night, it's not getting any better, it's preventing you from doing daily activities, and it just doesn't seem to go away, and it's been about 6 weeks, sometimes 2 months, 3 months, you should probably take a look at it, because the mistake frequently that I see when it comes to the shoulder is that you think that if you wait, it's going to get better. And sometimes the shoulder does the exact opposite. The longer you wait, the worse the symptoms, the more difficult it is later on to take care of it. So sometimes if the shoulder feels like you either injured it, or the shoulder doesn't feel right, or if it's painful, or if it's gradually becoming painful and it's not getting any better, probably you should have it looked at. The two issues that usually come up are related to muscle, tendon, ligaments in the shoulder, rotator cuff, tears, bicep tendon issues, and those things are usually addressed with a MRI, injection, conservative management, physical therapy. We usually try to address shoulder issues non-operatively, because the shoulder takes a long time to recover. When I operate on a knee, it tends to be weeks recovery. When we operate on the shoulder, I tend to have months recovery. And traditionally, it's 3 to 6 months recovery, regardless of what you do around the shoulder. If we try conservative management and it doesn't get better, then we address the shoulder surgically. From a musculoskeletal aspect, ligament, tendon, rotator cuff, we usually scope it. I fix the tendon, I fix the bicep tendon, whatever needs to be done. And usually you wear a brace for about 6 weeks. We do physical therapy, and usually, like I said, within 3 to 6 months there's good recovery. If, however, the issues are not related to the rotator cuff and are more related to the fact that there's arthritis in the joint, then we need to address it a little bit more aggressively. Again, we try conservative management first, cortisone injection, we try physical therapy. If those conservative things do not help and we need to address it, and the pain is still causing you issues on a daily basis, then we talk about some sort of a shoulder replacement. The traditional shoulder replacement tends to be a similar ball and socket like you have in the hip, and that is a stem in the humeral head and basically a polyethylene cup in the glenoid, and this is what a shoulder replacement looks like. But the shoulder replacement, in order to be effective, must have an intact rotator cuff. If your rotator cuff is not intact, which I see that very frequently, especially as we get older, or sometimes in the older population, even with a fairly intact rotator cuff, after the age of 70, the rotator cuff doesn't do very well. Then we tend to go with what we call a reverse shoulder replacement, which is similar, except that this time we use a stem, and the cuff goes on the humeral side, like this. And then we put the ball on the socket part, which is this area, and this is what your shoulder looks like. And this compensates for the fact that your rotator cuff is torn. And I've done in the hundreds, and patients are very, very happy. You usually stay in the hospital overnight. You go home with a sling for 4 weeks, and again, it's about 3 to 6 months recovery. But I'm getting excellent results with this shoulder. The pain goes away, the function, the motion gets better, and every single person I've done so far has stated that they wish they would have done it earlier and wouldn't have waited so long. The impact that these shoulders have on the patients are significant. Usually when they come in preoperatively, they're very painful, they're unhappy, they are unable to move their shoulders, they're extremely uncomfortable, they can't really do anything, they can't sleep at night, they can't use their shoulder, and usually their spouses or significant others tend to convey how unhappy they are and how much pain they're in. Afterwards, very happy, smiling, very functional, extremely happy that they have it done, and as I said, always stating that they wish they would have done it earlier and would have had this much earlier in order for them to be able to use the shoulder and not have the pain at night. Functionally, they do much better. They have better range of motion, better function, better strength, and I do think that's a very valuable tool I have in order to increase lifestyle for patients with this type of deformities.
You know, there are many new options in regard to treatment.
And Dr. Mendel is continuing to stay on the cutting edge with elite state-of-the-art treatment, including stem cell options that are not only effective, but affordable.
As it relates to non-operative management in regards to a joint that's worn out, specifically joints that we talk about our shoulders, knees, foot and ankle, specifically the ankle and the hip. There are options as it relates to non-surgical management. The specific option that I want to mention is stem cell injections. Stem cell injections got a lot of media publicity recently, and it's one of those things that I think needs some explanations because patients, I'm not sure, understand exactly what's going on. So there's two types of injections that recently have become popular. One of them is PRP, which stands for platelet-rich plasma, and one of them is stem cells, which is basically harvesting stem cells and injecting them into a joint. Both of them have good options that you can use them for. PRP injections, you can use them in a joint, you can use them in ligaments and tendons, and some studies suggest that they might promote a little bit better healing. So PRP definitely has a place as it relates to possible options if we repair a tendon, or if we repair a ligament, or if you want to inject it into a joint. It can definitely help facilitate better healing. It's a little bit less invasive. We basically obtain some blood from you, we centrifuge it and basically inject it back into the joint. So it's not as expensive because insurance companies do not cover PRP and they don't cover stem cells. But you hear about PRP a lot in the sporting literature with the NFL players getting all these injections. Usually it's just getting some blood, centrifuging him, giving you the injection. Cheaper and fairly benign type of a procedure. The stem cell injections are a little bit more involved and therefore a little bit more expensive. Again, it's not covered by insurance. And basically we harvest stem cells from the back of your pelvis, which is where you have the best concentration of stem cells. You centrifuge it down and then you inject it depending upon which joint is involved, in the shoulder, hip, knee, ankle. And usually the advantage is that the stem cells tend to migrate to the area of worn out cartilage and preferentially tries to create additional cartilage in the areas that are deficient, and provides better relief, long-term relief. And like I said, overall, there's been some good data to suggest up to 70% at least 1 year relief, although there's no guarantee one way or the other if it's going to help. Again, you have to make sure that the joint is worn out appropriately. You don't want to inject it in every single joint. You have to make sure that you're a good candidate for it. Initially, I started looking at stem cells because I did feel that it was a good alternative, although I heard that the places that are doing it, for example in Des Moines, charge about $8,000 to $10,000 per joint, and I felt that that was a little bit too expensive. So I started looking into it, and I was able to essentially find a way to do essentially the same thing for less than half the price, which basically gives the identical procedure, the identical way to harvest the stem cells, identical way to centrifuge them down, identical way to inject them, except that we don't use a big label behind it. It's by Arthrex, which is a very reputable company that basically essentially we're able to charge less than half of what they charge in other places. So I do feel that stem cell is a good option for a worn out joint instead of surgical management, and there's been some good data to suggest that it can delay the need for an eventual joint replacement. Just because you get a stem cell doesn't necessarily mean that you're not going to need a potential joint replacement in the future, but it could definitely delay the need. And if that is something that your joint is a candidate for and you're able to afford it and you want to do it, I do feel that it's a very good option.
Writing more things down, I see.
Yes, but this time you'll notice I'm not talking out loud while I'm doing it.
Well, that's progress.
Hey, there's a lot of information to remember there.
That's true. And you can always call Dr. Mendel's office at the number below for more information or a consultation. Dr. Mendel will be happy to answer all of your questions, discuss treatment options, and what's most important to you, getting you back to your best, happiest, healthiest life. You'll find Dr. Mendel's not only a brilliant doctor, but is someone who truly cares for you and getting you back to good health.
I'm in the business because I want to see patients smile, not patients frown. And nothing makes me happier than walking into a patient's room after we've done something and having him smile and happy. And I can tell you that doing those reverse shoulder replacements has been some of the happiest patients I've ever seen. I'm very happy to do it because I know they do well, and they come into clinic, they move their shoulder, they're happy, they're not as painful, they're more functional, they sleep better at night, and that is the only reason why it kind of makes you keep going, because other than that, you could do other things, but seeing somebody walk in after they've been unhappy, painful, and having difficulties with their life, and all of a sudden they're smiling, they're using more makeup, they're happier, they're laughing, they're functional, they don't have to be taken care of as much, they don't need as much help, and they're more independent. People tend to underestimate how much independence means when it comes to your life, and when you're able to take care of yourself, you're more independent, you're able to get around, drive better, sleep better, walk better, lift better, do all these things. It makes a big difference, and that's very rewarding to see somebody able to do that.
I don't have the pain that I did before I had this surgery, and I can move my arm all around, whereas before I couldn't move it very much at all. I'm very happy with my life. I do a lot of sewing, and I take care of all my grandkids, and I can do just about anything, and I'm happy with all the way it turned out.
For more information about Dr. Tuvi Mendel's elite, state-of-the-art treatment to help you live your best and healthiest life, call his office or see his website. If you have shoulder pain, you'll find Dr. Tuvi Mendel to be a shoulder to lean on.